Welcome again, ladies. Gay, you did a great job. Awesome, awesome. The lymphatic system, before we go to the lymphatic system is the health of your lymphatic system tells you the health of your immune system. So if your body is moving and the lymph in your system is actually moving, then it's a great indication of just how healthy your immune system is, okay? So immune system, which fights everything, equals lymphatic system. So the more you're moving, the better your lymphatic system and your immune system is going to be. The lymph is a very thin, transparent fluid that is oozed out of the cells after the blood comes through. Blood is full of fluid and everything, and it has nutrition and oxygen, and the cells take that part. They send off the unoxygenated blood through the veins, and then the cells actually ooze out this little clear, transparent fluid. There's a full system of vessels called lymphatic vessels that pick up this fluid. They run parallel with a lot of the vessels, the veins, and they go back to the heart, and then they dump into the heart just prior to the actual heart muscle. So they dump into the heart. This fluid, this white sort of transparent fluid dumps into the heart. It gets mixed with the blood. It goes through the organs to get cleaned up. It goes back to the lungs to get oxygenated, and then back to the heart, and then this fluid, which is now part of the blood, goes back to the cells. Does that make sense? So it's an entirely different vascular, I can't call it a vascular system because it's not a vessel. It is a lymphatic vessel, but it's not a vein in the sense that we think of. But they do run parallel. Okay. In the lymphatic system, the tubes they have very, very little contraction. Now in our veins, we actually have some contraction. Plus we have the heart pushing the blood through. Okay. The lymphatic vessels have almost no contraction to them at all. They do have valves that keep it from backwashing. You know, they open up and it goes that way and it closes off. It does have valves. But if you don't move, physically move, this lymphatic fluid really has a tendency to get congested. For instance, I don't have a heart pushing this lymphatic fluid around. If I didn't move my legs, and my muscles in my legs and my thighs and everything is actually what's moving the lymph back up to the heart. If I sat in a wheelchair or sat in a chair all the time, what do we find? We find people whose legs are swollen and their feet are swollen. A couch potato, their legs are swollen most of the time. Okay. A diabetic, we have multiple issues for diabetics, and we know what their feet and legs look like and what the problems they have with that. Okay. So the lymph is like solid butter when the body is cold. Okay? When you start exercising, this buttery solution warms up and gets more fluid. Okay? The lymphatic vessels are very thin, very small. They're like spaghetti strings and even smaller. So we're trying to get they're very good, Gay. Yeah, those are the lymphatic. That's the lymphatic tubules for the breast, and we'll go to the rest of the body too. But yes, they're very small. They're so small. They're like those little butterfly needles that you see the babies get. They get those little bitty vessel butterflies. They're like that. Those are some of the larger lymphatic vessels. Okay, so it's like trying to get cold butter through a spaghetti tube. If we warm up the body with far infrared, exercise, bouncing, moving, jumping, that kind of stuff, our lymph gets more liquid and it can move more fluidly. If we go without fluid, like not enough hydration or water drinking, huge. It takes the butter and practically freezes it. And makes that butter even thicker. So when we add water, when we add the proper amount of fluid in our system, we hydrate ourselves, we make all of our body, and I sort of call it, we go from a raisin to a grape. We want to be a grape with our fluid. You can't get the fluid in a raisin moving. You can get the fluid in a grape to move. Make sense? So we have real issues with the lymphatic system because people don't hydrate and then they don't move. So it gets very stuck and very sticky. and it won't go through these little spaghetti tubes back up to the heart. Okay, so to change that, we hydrate, we start moving, and then we actually take our hands and help manipulate the areas that we're trying to work with. Okay, let me show you on this. On this is, there's a couple methods of lymphatic. There's Vater and there's Chickley, and this is the Chickley method. They're both very much alike. This particular quadrant of the body, which is from the belly button around all the way to the back, and this arm, let's say the left arm, left breast and everything, 75% of that lymphatic fluid in that area drains. This goes up to the armpit. From the arm, it comes down into the this is called the axillary area. Okay? 75% of the fluid, lymphatic fluid, in this whole area goes to the axillary area or the armpit area, and from there it moves from the axillary, goes up to the it goes from the axillary area up to the clavicle, and then right along the top of the clavicle, it goes from here down into the heart. So we can actually make a huge difference in this quadrant by simply rubbing this area above the clavicle, and then by taking your hand and just gently pressing this area, which is this whole area here, up to the clavicle. So we can take this pump or this area of circulation and actually turn it on and move it. If we do this, we can actually increase whatever percentage we're not moving up to 75% of the fluid in this area to get circulated better. We can make a huge difference in our lymphatic system just in this area by doing this and this. And we do this. I stand around and I talk to people when I'm doing this all day long. They don't have a clue what I'm doing, you know, and I don't have to take my clothes off for it. And I can do this and just squeeze this up gently, and I'm trying to get that fluid moved up. These are some of the things that I will go over with you when you come for the educational piece. The next thing, does this make sense to you? Okay, for the feet, which is really interesting, everything in the feet, the legs, all the way up the knees to the groin, gather here and then go deep into the body up to the heart. So if we're sitting all the time, not getting up during our workday, not moving around, we're shutting off, we're cutting off this whole flow area through here of lymphatics trying to get up. No wonder we go home and our feet hurt. Okay, does it make sense? So what you would want to do is get up, move during the day, drink lots of water, move around. Just keep moving, okay? When you come to me, if I don't do anything, what I do is I will make sure you leave and you will know what's in your breast tissue. And we will find areas that are congested or not congested. Some of these areas will correspond with the thermograms, and sometimes we find areas that don't. And sometimes we find areas that aren't hot on the thermogram but are still congested in the breast. What the congestion feels like, and it's going to vary depending on the person, of course. It would be like when you hurt a muscle, you know how it gets hard? And you go, oh my gosh, right there's where it's sore. It's going to feel like that compared to this side versus this side. This one's not hurt at all, this one's pulled, this one's nice and firm. That's what we're going to do. We're going to check from breast, from side to side, comparing the areas of congestion. We usually do this without we look at the thermogram, but we don't use the thermogram as our guideline. We want to see what we have first of all, and then we go back and double check the thermogram is what we do. So I educate you on a breast exam. The first thing Dr. Wren has taught me, Dr. Wren is the one who's taught me how to do this, is to do a visual. We take our tops off in front of the mirror and we look at our breast every morning. We look at our breast and we're looking for symmetry. We're looking for fluid areas where if I raise my arms, is one side more fluidy here versus here? Is there fluid up here versus another area? So we look to see, is there a difference in the sides? Is one side more fluid filled than the other? And a lot of times you all are not going to see what I see only because I'm a little more experienced in it. But once I show it to you, you're going to have it. You're going to understand exactly what I'm talking about. So we check, what we start doing is we check visually. We want to see for symmetry. We want to check our nipples to make sure that there's no discharge. We want to check the nipples for any kind of retraction. Retraction is where the nipples pull in a little bit. Let's say one side's not retracting, the other side is. And a year ago, this particular side started pulling in a little bit. That is a huge sign of do something and do something now, because something is drawing and pulling on it from the inside. We also check the global. This is the global area. We check the global by pulling it side to side to see if it gets tucked in anywhere. Also, that will be showing that something is tugging on it from the inside. All right. You should never have nipple discharge unless you're nursing, ever. You should not have any kind of retraction. I have an individual I'm working with right now. When I go up, when she pulls it up like that, it gets pulled in here, which means there's something up here pulling on this, causing this to be concave. Okay, so she has retraction even under this lower area, which I've really not seen before. I've seen it in other areas in the global. All right, so we check for retraction, we check for symmetry, we check for temperature. There's a way to check for temperature. We take the back of our hand and we tap before we've already touched our breast, because once we start touching our breast, then it's going to change the heat, the temperature. But we tap gently around the breast to see if we can feel a difference in temperature. That's just to keep a good check. Okay, Dr. Wren wants us to check the lymphatic area. I mean, not the lymphatic, but the nodes, lymph nodes above the clavicle. There's a whole series here. There's a whole series under the arm that we all know about, and then there's lymphatic nodes all the way up the middle, and actually in all the tissue. So we do just a quick sweep of the breast tissue and across the clavicle to see if anything's developing. And if it is, if we find a lymph node and it's like, okay, so am I getting sick? Should I do, what's my protocols if I start getting a lymph node that's swollen? Like if we got one up here, we'd think, okay, am I getting an ear infection? Do I have a sore throat coming? That kind of thing. And just start being proactive. That's what that's about. Okay. The next piece of the exam that Dr. Wren has taught is how to examine the tissue, and we go through 3 or 4 different methods that we do. Palm row, a 3-dimensional, and then a pinching type piece that we do, and then an examining where we actually get in and actually feel it. So I'll have you go through these procedures on yourself first. I'll have you compare both sides. Now, if you have had no surgeries, you pretty well can get a pretty good image of both sides. This side on this side should feel sort of like this side. This should feel like these should all feel the same. If you had surgeries, we deal with that. We figure out what this breast feels like normally. We figure out what this breast feels like normally. And the only way to figure out how a breast feels normally, or what normal is to examine and do a breast massage daily. This is what we recommend with high ratings. We do the high risk. I encourage the women to do at least the breast exam 2-3 times a week so they get familiar with what's in their tissue, okay? And then we do a breast massage, which we'll go over in a few minutes. I'll show you that also. Once the women examine their own breast, then I will go and I will examine their breast for them. And when I find areas that are of concern or thickened areas, I will point that out to them, and then they will go in, and before they leave my house, they will understand this area is thick, it feels this big, the edges are fuzzy, it feels that deep, that thick, it feels about that far down in the breast tissue. You will know exactly what's in your breast tissue, okay? So that you can monitor that information the next day, or twice a week, or whatever you decide, however you decide to do the exam. We're suggesting that you do the exam weekly, the actual breast exam, where normally, once a month, and if you're lucky you ever did it at all. That's generally what we haven't done.
Especially high risk.
Especially high risk, right. So if you don't know what you have this morning, how are you going to know if it changes tomorrow or the next day? If you don't check your breast, you're not going to know. I help you get comfortable with how to do this process. You don't need me forever. Give me one opportunity to educate you, and then do as I ask and follow up with gay appropriate, and you can handle this and work with your caregivers. You can manage taking care of these breasts. If you are in a much higher risk area, we do suggest, according to the Dr. Wren's and our assessments, to follow up with further testing, and we can help you walk through that. Okay. You will understand.
Women who don't want,
right,
who want to heal their body naturally.
Right.
You have a choice.
Mm-hmm.
It's your choice. But it
right.
can be done.
It can be done.
She's talking about alternative tests that Mike Smith would be familiar with,
right,
and other alternative practitioners in this community would be familiar with them, but conventional medicine is not going to be familiar with them.
Okay.
It's not in the system. So that's
yeah.
it's important to
it's
make
important.
that clear.
It's very important, yes. When we have blood drawn, they put the needle here. First of all, they put a tourniquet on, right? And they tighten your hand, and this pops out, and they draw blood, okay? Would you walk around the rest of the afternoon with the tourniquet on? Why not? Well, it's going to close off the circulation, right? Same thing happens with underwires or bras that are too tight. It's like walking around with a tourniquet around your chest. Anything that leaves a mark restricts the lymphatic flow from here all the way up to here. Anything that leaves a mark. Any kind of surgeries that we've had literally cuts this lymphatic fluid, tubules and everything, and restricts the flow that goes up. You can rebuild lymphatic tubules even if you've had surgery. If you've had breast reductions, you can still develop lymphatic tubules if you work the tissue after the surgery. Even after that, you can still develop them. So once you've cut them, that doesn't mean they're gone forever. Okay, so as long as we're working on our breast, you can always redevelop better lymphatic tubules. Okay, after the exam, what we do is we teach you a breast massage, which is the sheet that you have there, and this is developed by Dr. Wren. And what we're doing is we're dividing the breast into a clock, and we're looking at 12, 2, 4, 6, 8, and 10. And then on this breast, of course, it's going to be 12, 2, 4, 6, 8, and 10. All right, so Gay's comparing a 9 o'clock on this breast to a 3 o'clock on this breast is what we're comparing. Does that make sense? Or a 3 o'clock and a 9 o'clock. Okay, so we're comparing those two areas equally. All right. So on the particular massage, what we're doing is we're dividing, once again, this breast up into 2, 4, 6, 8, and 10. And we take a nice firm hand, and what we're going to do is put oil or lotion, or you can use the soap. You can do soap in the shower. And we're going to generally I'll have you hold the nipple, because generally at our age, everything's a little more flexible. And if I did this, things just do this all the way with me. So the nipple just sort of comes with me. So what we're going to do is hold the nipple, and we're going to come in here with a really nice firm hand, and we're going to go all the way up to the clavicle, because breast tissue is all the way up to the clavicle, and all of this is breast tissue. So we're going to come up, and with a really firm hand, we're going to come in here, and I will help show you what this feels like, okay? And we're going to go around the clock a couple times at each location, and I'm going to take the majority of my work is going to come up under and into the axillary area, because 75% is coming into this area. I do have lymph nodes over here. Okay, as you can see down the center of that picture, you can see the lymph nodes. So we do it just like a clock, just like this drawing. And we do this every day. For those with high risk, we suggest they do this every day. Okay? If you do this, first of all, I have women who come to me who say, my breasts have hurt my entire life, or they hurt this much around my period. That's not uncommon. You should not have pain in your breast, ever, unless around your period, yes, they can be a little bit tender, okay. But if you do this, you can cut that tenderness even around the period, half if not almost all the way. I have women come back and say, I cannot believe this. They've hurt all my life. I've done 2 weeks of this, and I don't feel the pain anymore. What you're doing is taking a sponge, and you're squeezing it, and you're moving it, and you're washing it out, and you're using your water, and you're moving it, and you're bouncing. Get up in the morning and perk them up a little bit. Do something. Fluff them in the morning. Do whatever. So keep them moving. You want to fluff your breasts. You want to go without bras. You want to definitely go without bras. You want to get your bras off as soon as you get home. You want to enlist our spouses to help massage our breast. And if you get detoured
We
in the
definitely got
process,
witness here.
enjoy yourself,
Patrick's gonna turn
come
it
back
over.
the next night and finish it. So we encourage,
What we said earlier didn't get him this bit.
yes. So we encourage involving the husbands. We have husbands who come to us with the women, and they stand there, and I make sure that they understand exactly what's going on in the women's breast, in their spouse's breast, or their partner's breast. It doesn't matter. And they help with the process. I ask them, do you think you can handle this? I think I can do it. So we very much encourage involvement of the spouse, okay? The main thing is do something, don't do nothing. And so many of us are doing nothing. We go in once a month or once a year for our annual, and they slap our arms up like this, which stretches out all the lymph nodes. You couldn't feel a lymph node if you wanted to, like this. And then they do this real quick to you, and then they declare you, have you had your mammogram? If it's clear, you're okay. You're only a few weeks possibly away from an actual mass being caught. With thermograms, you have 6 to 8 years. Is it 8 to 10 years? Notice that you're getting heat built up so that we can actually be proactive and take care of them.
8 to 10 years.
8 to 10 years. In other words, heat starts forming 8 to 10 years before it actually develops into a volume of a mass that mammograms, MRIs can find.
In fatty breasts they can pick up.
In fatty breasts.
Not in dense.
In dense breasts, they can't find them anyway. So the only way you're going to find these is you're going to pay attention to what's going on in your breast. You're going to know if an area that is thickened and it's hot. If it's getting thicker, then you're going to do even more about this. You're going to, if you do the work we suggest that you do, you're going to find areas that are dissipating. And then when you go back to Gay for a follow-up thermogram, those areas are going to be less hot. And it's going to, the vessels form, the vessels that we saw on the thermogram presentation, form because there's a congested area and the body is saying, somebody feed me, somebody give me some oxygen, somebody clear this out, get rid of what's here. So vessels form to do that. The less we move them and the less we get work done on it, the more the vessels form, and then they start looping, which is a problem, and they get hotter and hotter. And that starts showing up on the thermogram. As you do this work, the vessels will cool down. The vessels don't really go away, but they cool down, so the image looks like they go away. Okay, so the heat in it actually dissipates, and the vessels appear not to even be there anymore.
They diminish.
They diminish. So we could tell how much you're making a difference over a given number of months, the health of the breast and how cooler it's getting by this imaging. That's why it's so valuable. What else? Let's see.
That's pretty thorough.
That's pretty. There's just lots of things that I go over with you, and the main thing is you will leave there and you will know how to work your breast, and you will know what's in your breast tissue so that you can monitor it yourself. You have these with you daily. I'm not there all the time. Okay? Now, if you are of high risk, I do have, there's manual lymphatic work that you can do, and then there's actually another thing that I do, which is cupping, if the women are really high risk, that I do. And it's sort of a breast cup, or if you've breastfed and you had a cup that you collected milk, it's that type of thing where it pulls the breast and releases, pulling oxygen and blood supply into the actual breast tissue. And then we work it and we do the massage to clean it out. So there is a process that I do above and beyond just manual lymphatic work.
It's a stronger lymphatic
It's a strong,
technique.
yes, it's a stronger lymphatic technique, and for those that are at high risk that I can do. But we don't want to do that. We want you to take care of this yourself is what we want. You can't live in my house, okay? I want you to do this yourself is what I want.
And I know this lady who made this tremendous improvement just recently.
These and this was
glad she went to Effie
and this
Spurlin.
is the first chance I had. I don't have those images. I just saw it and I'm going, oh my gosh, that really did
It's
work.
a powerful visual.
It works, ladies. I have women and come back in 2 weeks and say, I don't hurt anymore. I don't hurt anymore. And then they come back and they get these thermograms, and it's like, this does make a difference. I'm just here to empower you to do something for yourself. That's all I am. I don't do it. You have to do it for yourself.